Greater Lagos. Ìgbéga ìpínlẹ̀ Èkó àjùmọ̀ṣe ni.
The healthcare sector is one of the most important sectors that impacts the wellness and population of a state. It is also closely linked to the development of any country, playing a crucial role in maintaining its economic growth and stability. My name is Lucy Olugbe, and I welcome you to another exciting episode of Greater Lagos. Last week, we started conversations with Professor Abayomi, the Honorable Commissioner for Health in Lagos State, on the growth experienced in this sector through the tenure of this administration. This week, we will be delving further into a discussion on the current focus of the ministry, coverage areas of the Lagos State Health Insurance Scheme, and the plans this administration has to ensure medical practitioners find Lagos more rewarding and career fulfilling for their dreams. Right after the break, don't go anywhere.
Greater Lagos. Greater Lagos.
There's this growing trend of utilization of traditional medicine, which some medical doctors frown at the mention of it. So I would like to know, how safe is it, and then how effective is traditional medicine?
Okay, so historically, so we call Western-trained doctors orthodox medicine, and we refer to the alternative medicine. Some people call them ancient medicine, some people call them traditional medicine, some people call them alternative medicine practitioners. And there's a whole spectrum of therapeutic interventions that they offer, from herbal products to traditional bone setters, to traditional birth attendants, to acupuncture, to homeotherapy, to aromatherapy, to psychology. There's a whole spectrum, even spiritualists as well. So there's a whole spectrum of healthcare services that non-orthodox practitioners provide. Now, when we say non-orthodox, it doesn't mean that they're not trained. A lot of them have to go through quite elaborate training to be qualified to practice these variety of skills that I've just described. So what we've done in Lagos is we've formalized the Traditional Medicine Board. So we established a board made up of very senior practitioners in the traditional and alternative medicine space. Some of them are professors from universities, and they've helped us to establish the rules, the policies, and the guidelines, and the training curriculum that we need to put these various segments of traditional medicine through to enable them become competent in their disciplines of practice. So, for example, if they're managing, a traditional birth attendant is managing a pregnancy delivery, we've trained them to understand that this pregnancy is running into problems and that they shouldn't hold on to this patient. As soon as they notice that there's a problem with this delivery, they need to alert the nearest primary healthcare facility so that the patient can be moved and managed by personnel that have a little bit more understanding around complications to do with pregnancies. That way, we are making an effort to preserve the life of the mother and, of course, preserve the life of the infant. Because if you go through a complicated pregnancy and you don't have the right expertise around, both the life of the mother and the child can be threatened. So that's just an example of what we're saying. We want the traditional medicine colleagues of us, and we're calling them colleagues because that's what they are. First of all, to be competent, but more importantly, to understand the limits of their expertise so that they don't try and operate outside of their expert base and put citizens at risk. If we can get those two correct, then there will be a seamless synergy between the alternative medicine practitioners and the orthodox medicine practitioners, and they can handle simple things in community. When they realize that something is complicated, they can refer it into our primary, secondary, or tertiary systems.
Okay, so you said the governor has given go-ahead to recruit doctors and other health workers. Let's talk about welfare of these health practitioners. They are the core driving force of the sector. What is the government doing to ensure that they are well compensated and not relocating abroad? We've had issues with brain drain. So what are the welfare packages that are available for health workers in Lagos?
We are experiencing a significant demand for our healthcare professionals. And it's not just doctors, it's doctors, nurses, and other allied health professionals. And of course, they are seeing, certain conditions that are making migration attractive. What we are doing on our part is, first of all, to build a more sophisticated healthcare system, a more comfortable environment for them to practice. So like I said, we're spending a lot of time on infrastructure, because if you're practicing any discipline, the first thing you need is the correct environment to practice your expertise. If I ask you to come and perform an operation and the air conditioner is not working, it's too hot, there's no water in the theater, things like that, then you become discouraged as a professional. So we're paying attention to the work environment to make sure that our medical professionals feel that they're in a space that is matching their expertise. The second thing we're doing is obviously increasing the numbers, because if you are working in an environment, and medical professionals tend to work very extended hours, and they work on call and through the night, so they are susceptible to burnout, and exhaustion. And also you have to understand the type of work that they do. Doctors and medical professionals see people every day with problems. It's not, nobody comes to see a doctor to give the doctor a good story. It's always, the person is not well, and this also has a psychological impact on the care providers. So we have to look at their mental well-being as well as their physical environment, and make sure that there are enough numbers, that they are not being overworked and seeing too many patients, which would cause exhaustion and burnout. So paying attention to numbers, Mr. Governor has specifically paid attention to this concept that as doctors or medical professionals are leaving, that we can replace them almost immediately. Then we're looking at, softer things like, accommodation. In the past, when we used to build general hospitals or medical facilities, we didn't incorporate accommodation for medical professionals. Moving forward now, all our new hospitals have deliberately incorporated accommodation for medical professionals. Moving backwards, we're going back to some of our hospitals, and we're starting to build accommodation in hospitals that didn't have accommodation before. So that makes life easier for the medical personnel, particularly if they're on call, and those that are in very busy units, that they don't have to get up early in the morning to get to work or leave late at night, driving long distances to get to their homes. So then we're looking at allowances and various hardship allowances and hazard allowances and trying to find a way to compensate medical personnel for working in hazardous environments or working in remote environments so that we can encourage them in that direction. We also want to make sure that we're paying attention to their training, because if you can put medical professionals into training, they're less likely to want to emigrate out of the environment. So we're trying to encourage our doctors and our nurses to advance their careers through various training programs, and to make sure that they feel that they're acquiring the skills sets here in Lagos.
Now, in all of this training, where is the place of research and development in our healthcare system?
So, this is one of the profoundly neglected areas generally in Africa and in Nigeria. And so what we're doing, generally speaking, research is the foundation of innovative medicine. If you are not discovering things, if you are not understanding how diseases in your citizens are behaving, what kinds of medication are required, then you are cutting and pasting. You're taking practices from Europe and America in populations that are ethnically different from the African population, and you're essentially experimenting, because you've not proven that these are the right treatment modalities for these environments and these ethnic groups. So what we're doing in Lagos is we're promoting indigenous research. Generally speaking, we get our funding for research from institutions abroad, like the Wellcome Trust or the National Institute of Health in America, or the Japanese foundations, Australia, Canada, and Nigerian medical personnel compete for this international funding to carry out their research. What we're trying to do in Lagos and Nigeria now is to create funding, local funding from our governments to drive research agendas. So Mr. Babajide Sanwo-Olu, for example, has released significant funding during COVID and outside of COVID, and we're issuing grants to a variety of young researchers, intermediate researchers, and seasoned researchers that are receiving funding from our governments. Because when you receive funding from external governments, quite often there's a reason why they're giving you that financial support. And it's because there's probably an agenda in there. But as a Nigerian government that is giving Nigerian money to Nigerian researchers, all you're trying to do is to ensure that we understand the disease profiles in our environment. We're able to predict the causative factors of disease. We'll be able to understand through clinical trials how our people respond to various treatment modalities. This came out very clearly during COVID. At the beginning, you could watch on television, on BBC and CNN, that how patients were being treated in Europe and America. And since we didn't have any patients yet, we started to prepare in the same way as we were seeing on television and reading in our journals. But as soon as we started seeing patients in Lagos, it wasn't up to a month or two, we started to conduct our own research. Mr. Governor gave us quite a lot of funding, and we engaged our seasoned academics from our 2 teaching hospitals in Lagos and from the general hospitals. And we started to try to understand how COVID is behaving in Lagos. And we found that there were significant differences. And so we stopped cut and paste, of how people were being treated in Europe and America. And we developed our own treatment strategies here in Lagos, which meant that, of course, we had better outcomes because we're using our own experience to treat our own COVID patients based on our research. But also, it was very significant in that it was very cost effective because we were not using treatment modalities and very sophisticated equipment that wasn't going to work anyway. So we're able to rejig our strategy towards managing COVID and managing it in a very cost effective way based on our own understanding of how COVID affects our people, and that came from our own indigenous research. That just points out to you how important research is in your environment and especially funded by our own governments.
Greater Lagos.
We take a break now to bring you Eco Daily and Mega Citizens. We will be right back.
Did you know that no fewer than 230,000 vulnerable and indigent residents in Lagos State are currently benefiting from the free health insurance coverage? This empowering initiative is sponsored by the Lagos State Government through the Eco Social Health Alliance, ECOSHA. ECOSHA was designed as a social welfare empowerment program coordinated through the Lagos State Health Management Agency and in alliance with private institutions and multilateral partners seeking accessible health care for all Lagos residents, including residents who can't afford it, so no one is left behind. The identified beneficiaries in the program include orphans, elderly, teens moms, victims of sexual and domestic violence, as well as other vulnerable groups. The insurance also covers special conditions like tuberculosis, HIV/AIDS, sickle cell anemia, and lupus. Interested members of the public can make inquiries to participate in the ECOSHA initiative by contacting Lagos State Health Management Agency through the websites on your screen or email ecosha@lashma.com or through a phone call to 0800 Ask Lashma 0800 27 5527 462 0800 27 5527 462. That's all on Eco Daily today. See you next week.
Greater Lagos.
And even in Nigeria here, you find out that most of our trado doctors are now using the herbs. You know, they produce them in tablets as supplements and we take them. So my own advice, as far as I'm concerned, if both the doctors and the traditional doctors can come together, you know, and then make use of what we have to get more of these drugs, these supplements, it will be very, very good.
They can be added to our medical health care if there are people that is properly trained on it. Like all these our deep Yoruba traditionalists. If they really know about it, not that someone will just wake up and say, plug this, when you don't even know the measurements. You know, everything, every drug has to do with measurements.
Greater Lagos.
Let's talk about the Lagos State Health Insurance Scheme. How does this benefit an average Lagosian?
So health has to be purchased. Somebody has to pay for health. Either the government pays for health or the patient pays for health. So over time, initiatives have arisen called health insurance. which is an individual taking out a health insurance package while they're well, should in case they require health care in the future. And that's a very critical way of addressing health financing, especially in an environment like Africa or Nigeria, where government IGR, internally generated revenues and budgets, are not in the sort of dimensions that can allow a government to provide unlimited free health or free education. So health insurance is a concept that is very important, that comes in to introduce what's called financial pooling and cross-subsidization. So we've had a health insurance law in Lagos and at the federal level, but recently it's been reviewed, and Mr. President has just approved the new NHIA, that's the National Health Insurance Authority Act. What is important about this act is that for the first time, it stipulates that all Nigerians must have social health insurance packages. So everybody in Nigeria, including Lagos, every citizen living in Lagos, and let's domesticate it now, everybody in Lagos must have social health insurance. Our social health package, insurance package in Lagos is called Isaac-Yerokun. And up till now, it has been voluntary. But by virtue of this new act, it's now become mandatory, which means that everybody must buy it, and we're about to put processes in place that ensures that every citizen acquires this health insurance. And what does that do? It allows you to present yourself to hospitals having paid your premium once a year or every month as you choose. And then once you have your insurance, you can go to your facilities and receive a bouquet of health services free of charge. It will now make the delivery of healthcare much more effective. It will allow us to achieve universal healthcare coverage because everybody will have insurance. So it's a very ingenious way of managing care and managing the resources that you require to deliver high level of internationally benchmark treatments.
So when you say basic care, is it just malaria? What kind of services are you?
So we address the bread and butter of most patients. So you're not feeling well, you have diabetes, you have hypertension, you have a fever, your children are sick, you need immunization, you need birth control, you're pregnant, family planning, delivery, cesarean sections, and eyes, ears, and the plans just get more and more. It will be a situation where as more people key into it, the services continue to improve. And the facilities also continue to improve because the facilities benefit from payments from the insurance schemes.
At this point, we would like to say thank you very much, Lagos State Commissioner for Health, Professor Abayomi, for spending time with us on the program Greater Lagos.
It's been a pleasure. Thank you.
Greater Lagos.
You can tell that this administration is deliberate in its effort to change the face of public health in Lagos. And we can see the results as more people are growing confident in Lagos healthcare system. There you have it on this week's episode of Greater Lagos. Till we'll come your way next week, same time, same station. I am Lucy Lugbe. Bye for now.
Greater Lagos. Ìgbéga ìpínlẹ̀ Èkó àjùmọ̀ṣe ni.